Wow, just fascinating look at that training there. Today, the CDC officially gave cruises the green light, completely lifting its risk advisory. That's just one sign that COVID-19 might be entering a new stage. And a local infectious disease expert agrees, saying that COVID is no longer a public health emergency. CBS 1's Karli Barnett joins us in the studio with more on this. Karli.
Well, Jim, Lauren, I think I could finally bring you just a little bit of good news when it comes to the pandemic. Now, I think we've all seen how things have changed these last few months with COVID, certainly more lax restrictions, but don't get too excited because COVID is not over by any means, but we are not in the dire place we used to be.
Americans are back to living their lives again. We can't surrender that now.
President Biden spoke Wednesday about moving into what he called a new phase of the pandemic, one where COVID is no longer in control.
Over 99% of our schools are open again. Businesses are open again.
Here in South Florida, infectious disease expert Dr. Aileen Marty says while COVID is still a concern, it's not the imminent threat it once was due to increased immunity and treatments.
The virus is still here, but we have a lot of personal protection with the vaccines and from prior infections.
That's why she says many of the sweeping COVID restrictions have been safe to roll back.
From a public health perspective, it's no longer an emergency because we're not seeing overwhelming numbers that are using up that need so much care.
This does not mean COVID is completely gone.
Is it still out there? Yes. Is it still a threat if you're unvaccinated and you haven't had COVID? Absolutely. Virtually everybody I've seen in the hospital lately is an unvaccinated person.
But she says now it will be up to the individual to decide the level of precaution or risk they take.
Now, another point to show we are moving in the right direction. The American Academy of Pediatrics says last week's numbers showed the first time that child cases dipped below 30,000 since last July.
That is encouraging. But Karli, let me ask you this. We had a lot of people in town the past week with spring break and, of course, Ultra. Might that lead to a spike in cases?
The answer is yes. And as Dr. Marty pointed out, traditionally we've seen after holidays or high travel periods or crowds like these, there will be an increase. So she says hospital numbers have remained pretty steady, but there was a slight uptick over these last few days. But she says it's not altogether surprising. And we also have to keep in mind there is a newer variant, that BA2. Dr. Marty says BA2 has about the same level of severity as the original Omicron, but it is contagious, and if you had Omicron, you can still get this. So keep that in mind.
Yeah, a lot of people in those crowds behind you, but not a lot of masks. I don't think I saw any. Obviously, a lot of the mandates have been lifted. What does Dr. Marty say? Should we still be wearing them?
Well, so if you're someone who is immunocompromised or you're in contact with someone who is high risk, then yes, Dr. Marty says it is still a good idea to wear those masks indoors. And of course, if you're sick with a respiratory illness or you've been directly exposed to someone who is sick, you should wear a mask because that is just the respectful thing to do. But she said if you've had your vaccinations or you've had COVID in the past, you feel healthy, you are considered low risk and okay to go without a mask. Like she said, it's largely the individual decision at this point.
Karli Barnett, thank you.